Addressing barriers to device counseling. We mentioned earlier some of the barriers healthcare professionals say hinder routine device counseling. Here are some suggestions for integrating optimal device counseling in your practice. Counseling on device technique is important enough to develop policies and procedures for your practice or pharmacy. Who will do the counseling? Although any trained healthcare professional should be able to counsel patients, it may be easier for some members of the team to integrate this into their workflow and routine duties than others. Even if all are not involved in the actual counseling, all team members can assist. Facilitation may include asking patient to wait, letting the educator know that the patient has arrived or is available, and reinforcing the importance of technique. Who will be trained and how will training occur? Training will encourage consistency of approach, regardless of which pharmacist, nurse, respiratory therapist, or health educator sees the patient. Also, healthcare students with supervision may teach patients. We suggest that each healthcare professional who counsels patients receive initial training. Their technique should be assessed with a standardized check sheet. Each should be reassessed periodically. Device counseling is a suitable topic for continuous quality improvement in your practice. Designating device counseling as a quality improvement monitor is one way to show that it is a priority for everyone at your practice. Lack of time to do the counseling was commonly reported as a barrier. Initial instruction may take several minutes, but one study noted that after initial instruction, routine checks of technique may only take a couple of minutes. Plan how counseling will be integrated into the workflow. Timing is important. Those surveyed also reported a lack of suitable resources to counsel. To use our comprehensive framework, several resources are necessary, including placebo devices for patient instruction, one for you and one for the patient. Sometimes initial instruction might be performed with the patient using the actual prescription device. References and resources, including patient educational materials, handouts, and websites. We mentioned earlier the limitations of written materials that are available. In selecting materials for those with low or average health literacy, you might use the suitability assessment of materials as a tool to guide you. This tool can also be helpful in developing or revising your own materials. However, it only assesses health literacy aspects of materials. Other aspects, such as the potential for bias and currentness of information, should also be evaluated. For information on this tool, see our reference list. It is useful to have advanced materials for those patients who might seek more information than the typical patient. Visual and kinesthetic learning styles should also be considered in selecting materials. The Medical Library Association has a tool on their website that you can use to evaluate the quality of any internet sites you are considering recommending to your patients. Pictures and three-dimensional models of the respiratory system might be useful depending on the age and health literacy of your patient populations. You might consider holding a focus group of your patients to provide you with feedback on the educational materials that you plan to distribute. For systematic implementation, flow sheets in the patient's record are useful to document the frequency of counseling sessions and patient progress. Development and use of documentation templates can increase the speed and consistency of documentation in the electronic medical record. Lack of patient interest was also mentioned as a perceived barrier to counseling. Sometimes providers are reluctant to recheck technique because they are unsure how to open the conversation. Laying the groundwork at the initial instruction about the importance of technique to the drug's effectiveness makes opening this conversation much easier. Emphasizing the importance of technique to controlling their symptoms is usually enough to generate cooperation. For example, last time you were in, we talked about how important it is to inhale the medicine just right for it to get to the lungs and work properly. Please show me how you have been using your inhaler at home. We want to be sure that you are getting the most benefit from your medicine. Occasionally, a patient expresses reluctance by saying they know how to use it because they have been using this device a long time. To that, you can respond, I realize you have had asthma for many years, but technique is so important. Please show me. I want to be very sure that you are getting the full benefit of your medicine. Once patients realize that their technique was not totally correct, they often become interested in learning more. However, healthcare providers do need to be sensitive to the timing and frequency of sessions so that device checks are not bothersome. So, in summary, inadequate device technique is widespread. Device technique is crucial to drug efficacy. Inadequate technique will result in poor drug delivery to the lungs. Improving technique can improve patient outcomes as well as decrease side effects and healthcare costs. Our device counseling framework includes a multi-step process with verbal instruction and rationale, a demonstration, hands-on practice with a placebo device by the patient with assessment and feedback from the provider is crucial. There is no substitute for direct observation of the patient's technique. Provision of written information. Documentation is important to follow up at later visits to encourage consistency in content and approach over time. Device technique is too important to be left to chance. Remember that repetition and reinforcement is necessary for their technique to become habitual. Documenting issues on prior instruction assists in planning and implementing follow-up. With training, planning, and the right resources, we can improve patients' device technique and thereby improve the lives of our patients. Lastly, we believe that device counseling is a multidisciplinary responsibility. Physicians, nurses, pharmacists, respiratory therapists, asthma educators, and any healthcare professional involved in the care of respiratory disease all play a role in assisting patients with this important skill.